Welcome to Medifer. The topic is urinary tract infection. So here let us get familiar with the terms used in the diagnosis of UTI. First you have to know what is significant bacteriuria. Significant bacteriuria means if the urinary pathogen in the urine is more than 10 power 5 colony forming units per ml, then we call it as significant bacteriuria. This bacteriuria can be present without symptoms also. Then we call it as asymptomatic significant bacteriuria. And it can be associated with the symptoms also. And those symptoms, like it may present it as uncomplicated UTI, means just symptoms of cystitis. Complicated UTI means symptoms of pyelonephritis can be present with structurally or functionally abnormal urinary tract. So you have to notice here, in case of uncomplicated UTI, there should be no symptoms of pyelonephritis and the structure of the urinary tract should be normal. Uncomplicated UTI means either the structural or functional abnormal urinary tract. So the numbers that you have to remember is significant bacteriuria means more than 10 power 5 colony forming units per ml. Significant S looks like 5, right? So remember 5, 10 power 5. Now let us know what are the organisms that lead to the urinary tract infection. So let me categorize this into 4 set of population. Okay, in case of outpatients, in case of inpatient, in case of pregnant females, and in case of children. Always remember, in the UTI, the most common organism is E. coli. E. coli is the most common, and the second most common is Staphylococcus saprophyticus. Can you remember, second most common, second start with S, right? Second double, it is Staphylococcus saprophyticus, SS. And UTI is more common in females because of short urethra. In case of inpatients, hospitalized patients, okay, here like catheterized patient, here also E. coli is most common, and the other organisms are Klebsiella, Serratia, Enterococcus. Then coming to the pregnant females. Pregnant females, they present with asymptomatic bacteriuria most commonly. They present with asymptomatic bacteriuria, and there is a higher risk of this asymptomatic bacteriuria developing into pyelonephritis. So we consider treating asymptomatic bacteriuria also in case of pregnant women. And in children, if they are presenting with recurrent UTI, you should be evaluated for vesicourethral reflex or sexual abuse. I repeat, the most common organisms involved in UTI are, in first aid book they have given, say this: E. coli is a leading cause of UTI. Colony shows strong pink lactose fermentation on McConkey agar. This we know. Then the second most common is Staphylococcus saprophyticus, particularly in young sexually active females. And healthcare associated, that is inpatient, it is Serratia, Enterococcus, Pseudomonas, okay? And Proteus mirabilis is associated with struvite stones. So which is the first most common bug causing UTI? It is E. coli. Second most common is Staphylococcus saprophyticus. Third most common is Klebsiella pneumoniae. Okay. Now, how do you treat this? Or how do you diagnose this? Okay. The sample should be urine. You should take fresh, clean, catch midstream urine. Midstream urine is collected. And suppose if that is not possible, suprapubic aspirate is taken, that is in case of obstructive uropathy. And most of this time we don't recommend sample from catheter. The culture is you go for urine culture with clad medium, which I have explained you in the previous video that clad medium is better than McConkey agar for the culture, because most of the time the UTI causing organism is E. coli, right? So why clad medium is better? See, if the UTI is caused by some gram positive organisms or other gram negative organisms, it should be less inhibitory. So we use clad medium. If we use McConkey agar, it might inhibit the growth of other organisms, so you might miss the diagnosis. Now, this I have already explained you. Criteria to define significant bacteriuria, that is more than 10 power 5 colony forming units per ml. This is asymptomatic in asymptomatic individuals. Suppose if the patient is symptomatic, he is presenting with symptoms of cystitis or pyelonephritis. Okay. In case of females, it is more than 10 power 2 coliforms per ml or more than or equal to 10 power 5 non-coliforms per ml, and in males it is more than 10 power 5. In case of catheterized patients, it is more than 10 power 3. Catheter C for C, 10 power 3. Don't get confused with the numbers. Like significant bacteriuria, mostly asymptomatic patients or symptomatic patients, we see the number, it is more than 10 power 5 colony forming units per ml. Okay. Only in case of symptomatic females, that too if they're just coliforms, more than 10 power 2 is enough. In catheterized patient, it is a third letter C, so 10 power 3. And any single growth of the pathogen is also significant in case of sample that has taken from suprapubic aspirate. Okay. So we are okay. Now we are going to the treatment part. Treatment told uncomplicated UTI means uncomplicated. You should remember there is no fever, no nausea, vomiting, and no costovertebral angle tenderness. Why? These are the signs of pyelonephritis. So there should be no pyelonephritis. In uncomplicated UTI, you should go with the oral medications like trimethoprim or sulfamethoxazole or ciprofloxacin or nitrofurantoin. And remember, ingestion of cranberry juice and urination immediately after sexual intercourse decreases the incidence of UTI. Then, for the treatment of complicated UTI, you treat accordingly. Okay. Now the question is, what about asymptomatic bacteriuria? Do you need to treat? Yes, it is treated. It should be treated if they are pregnant. It should be treated if they are pregnant, or if they had any surgical urological intervention, or if they had hip arthroplasty. Okay, I repeat, asymptomatic bacteriuria, not all patients with asymptomatic bacteriuria are treated. They are treated only if they are pregnant, if they had surgical urological intervention, and if they had hip arthroplasty. And one more note point I need to tell you, if there is sterile pyuria, okay, that is more than 10 WBCs per high power field, that is pyuria, which I have told you, if it is sterile pyuria, means no organisms, in a setting of negative urine culture, okay, then it suggests that it can be the infection of gonococci or chlamydia trachomatis. This is about UTI.